So once again, issue 1, the Amazon, Berkshire Hathaway, and JP Morgan joint healthcare venture is good for the healthcare industry. Team A will be arguing the pro position, and I invite them to begin with their opening statement. You have 2 minutes.
Hello everyone, my name is John Curtis and I'm a medical student at Geisinger Commonwealth School of Medicine. Me and my partner here, Mark, we will be debating this topic, and we think this is a good topic to debate, and we think that, first of all, that the Amazon, Berkshire, and JP Morgan joint venture is going to be a good thing for the healthcare system. First of all, everyone here can recognize the debilitated state of the current healthcare system out there. There are such things, we spend $10,000 plus per capita, just in 2016 compared to other comparable countries, which, averaged around 5,000 per capita, and the highest after us is Switzerland at about 7,000. So, given the amount that we spend on healthcare, we actually have abysmal, if not equal outcomes to these other countries. And there are many different reasons for these. These outcomes can be measured in multiple different, facets, such as life expectancy, the opioid epidemic, maternal mortality, and the obesity epidemic, which is currently plaguing the United States as it is. This joint venture is trying to set an example for how healthcare should be done. As mentioned previously, we know how broken the system is, and based on the amount we're spending, the outcomes are just not there. So any venture such as this, trying to address the frank issues in providing reliable, consistent healthcare, is only beneficial to the system, and albeit a slow process. They plan on cutting out the middleman in the healthcare system to reduce costs by at least 15%. And these include things such as administrative costs, high prices, and improper healthcare usage. And we all have to remember that Amazon is especially good at this, given that they produce their online market by completely limiting sellers to the direct suppliers and manufacturers. Thank you.
Thank you, Team A. Team B, I do have a microphone for you guys to use, so here you go. You'll have 2 minutes as well for your opening statement.
Can I as well?
Sure thing, yeah.
Good morning. My name is Wesley. Along with my teammate Corey, we're going to take the con stance on the Amazon merger. Not to say necessarily that healthcare is not broken. I think we can all agree that it has very serious problems. What we are going to argue today is that there is actually very little substance known about this merger. So at this point, we don't have much we can say that they will do this or will do that. We can say that they have a very noble aim. We agree that this is something that needs fixing. We do not think that they will be the ones to fix it. We think that in the end, there's going to be such effects as changes to patient and physician autonomy. There might be changes to patient quality, and a lot of reverberating effects that are unforeseen by these three companies sitting together and trying to pour out the problems to fix the rest of us. That the problem is probably going to come from other avenues and not from the three wealthiest men in the world. Thank you.
Thank you very much, Team B. We'll now be beginning 10-minute question and answer session, which will begin with my questions for each team. Team A, I know you guys talked about the need for cutting costs, the importance of slashing them by 15 to 20%. That's typical of what we've seen from the joint venture's claims about how they'll increase administrative efficiencies. Now, I've also heard similar arguments made for why a single-payer system could potentially increase quality of care while reducing costs by eliminating those administrative inefficiencies. Is it not fair to say that this joint venture is simply single-payer done wrong?
This venture is a social experiment, if you will, for the employees of the three companies. And I'm sure the three wealthiest men in the world, as the opposition pointed out, are well aware that a single-payer system is not feasible at this moment in our healthcare industry. they are working towards giving healthcare affordably to their employees only. And by that amount, they'd be able to cut by 15%.
Yeah, and to go off that, this isn't a single-payer system gone wrong. They actually have very direct avenues which they can go down to cut healthcare costs. One of the main things is the pharmacy benefit management companies, which ultimately use rebates to get up to 25% of the sales back towards themselves. Another issue that there is the insurance brokers. Understandably, a company, there's so many different options for insurance. They hire people to actually help them sift through what is available. And by cutting these costs and working with the insurance companies directly, we can make healthcare more affordable in that sense. So I don't think it is a single-payer system gone wrong.
Thank you, Team A. My question to Team B stems from your comment about a lack of clarity as to what this joint venture will be doing. But I think if you look at the decisions they've made in the 8-9 months or so they've been in existence, some clarity starts to come into formation. So the announcement was made in early January of this year that this joint venture would be taken underway. And by July of this year, Atul Gawande, a physician in the Boston area, was appointed as head of this venture. Additionally, we understand Amazon is primarily a supply chain and logistics company as well as a consumer experience company. Berkshire Hathaway as a holding company has managed insurance, and we know JP Morgan is responsible for financials. I think these things tell the tale of what they're trying to do. Create an opportunity for healthcare to be more consumer-friendly, more direct, less middleman, more cost-efficient. Would you not agree that their plan, while maybe not written out for everyone to see in the New York Times, is pretty clear and probably a strong argument for how we can save costs in healthcare?
I disagree that there is a lack of clarity on the part of this venture. I mean, we have a lot of speculation, and a lot of the things that we know that they want to do comes from Dr. Atul Gawande, who's running this. I do want to point out that this is a quote-unquote nonprofit venture for 3 companies that rose to prominence through being for-profit. And though I think that it is a noble goal and a reasonable goal, I just do not think that it works well for the employees or for these businesses. The opposition noted that this is quote-unquote a social experiment for the employees, and I don't think we should be experimenting with people's health care. I think that the best way to go about this is through legislation.
Thank you, Team B. We'll now be moving to the question and answer session between each team. Team A, I'll ask that you can ask the first question for Team B.
So you mentioned that that this venture is its own, it's a part of these companies, when actually it is its own company with its own appointed CEO, Atul Gawande, who has a very reputable, he's very reputable, he's a great writer. I had the pleasure of hearing him speak last weekend, and do you think that because it's its own company and not actually part of the aforementioned companies that it actually can't be a nonprofit?
I would like to clarify a few things on that. What they said was free from the profit-making constraints. They did not use the phrase not profit, which again leads to speculation. It's widely reported as a nonprofit, but I just want to remind that might be a guess. Also, although it is its own company, its primary purpose will be to look after the other the employees of the other 3, which if you look at things like working conditions from Amazon, we know to sometimes be very suspect. So again, very good intentions, but very unclear to follow through.
Team A, you have 30 seconds if you'd like to further clarify on that question.
Yeah, no, thank you.
I invite Team B to ask their first question.
Right. So how would you say this compares to a lot of other companies that are much further advanced, say like Google's health ventures? Alphabet has its fingers in a wide array of the healthcare field, and Amazon's very late to the game.
While they're late to the game, they have partnered with two of the most impactful companies, Fortune 500 companies of the 21st century, and I think that they'll be able to make a splash. At the very least, this is going to serve as a model of what could be for corporations moving forward to cut out the middleman, being insurance companies. A healthy employee is a more productive employee, and I think most corporations can agree that's what they're looking for.
And to add on to that, yes, they are late to the game, but they can build off of what other ventures have done and learn from their mistakes. Not only that, but Warren Buffett himself, he said that we're not in a hurry. We'd like to be in a hurry, but we're going to try to do something. We're not going to try to do something faster than can be done.
Team B, would you like to clarify? 30 seconds.
So learning from others is great, but looking at how far along the competition is and the fact that Amazon took 10 years just to get established, in 10 years' time, they might be left in the dust.
Team A, I ask that you may pose another question for Team B.
Yeah. No, we're good on questions.
Team B, I invite you guys to ask any additional questions you have for Team A.
So my question would be that they mentioned that they do want to lower the own company's healthcare costs. Do you think that their primary intention is to lower the healthcare costs or to provide better care for their employees?
So I think that it's both. By lowering healthcare costs and they can essentially get healthier employees because they'll have more affordable access to these to healthcare, and then it will enable the employees to be more productive long term. I think that this venture will be very good for them in that sense because they really want to do everything they can to reduce costs and reduce the inefficiency that is our healthcare as it stands currently.
Team B, any additional follow-up for that question? No? Team A, any additional questions at this time? Okay, at that time then, we're going to move on to the audience question and answer. So what I'd ask you to do is if you're interested in asking a question for either Team A or Team B, you simply stand up and go to the nearest mic to you. I'll call on the number, and then you're free to speak. Just please go ahead and introduce yourself, state which team you'd like to answer the question, and then go ahead and ask your question. Now, I understand it can be tough sometimes to be short with these questions, but we do ask that you try your best not to use this as an opportunity for exposition of your own. Please try to keep things concise and relevant to the question at hand as best you can. So like I said, at this time, those in the audience are now free to ask questions. Go ahead.
This is for both teams. I'm sorry. What do you think the impact of the triumvirate working on health care will be on Medicaid and access to care for the poorest of Americans?
So the question is about the impact this venture will have on those who are receiving Medicaid, the poorest in our country, and their access to care. We can begin with Team A's response to that question, and then we'll give Team B a chance to respond as well.
So me and my partner here, we think that this actually won't have a negative impact on Medicare or Medicaid because this venture is designed for the employees of the companies, about 1.1 million of them. And they hopefully would like to expand their product to all 150 million employees in the United States who currently get their health care through their employers themselves. So personally, we don't think that it will actually have an impact on Medicare nor Medicaid.
Likewise, I would like to say that I think it's probably going to be a minimal effect at best, but if they go the route, follow with what Alphabet's doing, they could end up hiring their own physicians to go do visits of low-income households, which would then be paid for by Medicaid, which would be an additional strain on the system. However, since these three companies combined have a very modest employee load, it's probably not going to have much of an impact at this point.
Thank you. Microphone 3. And again, I'd like to ask those at the microphone, go ahead and introduce yourself to start, and then please ask your question.
My name's John. I'm a medical student at Geisinger. I just have a question. Given Amazon's recent and very public history of negative employee relations, what sort of steps do you see them taking as far as working with their employees in this venture at every level of the company?
Would this be a question for Team A?
Both teams.
Okay, both teams. We can go ahead and have both teams respond.
This Triumvirate will be its own company. It is not managed by the same people at Amazon who have had the problems in the past. Dr. Atul Gawande is appointing his own staff, which they will appoint their own staff, and so forth.
There was an article that was recently out about Amazon and some of the warehouse conditions. And there was also questioning about how much Amazon employees were being paid. So I think at least this kind of questions the real intention behind this venture, whether it's truly just cutting healthcare costs while raising quality of care. But if you can't raise the quality of care, are they still going to go through with this just because it lowers the costs? So I think that some of the recent news with Amazon really brings that stuff into question.
Thank you.
I'd also like to add that although it might be a separate company, it will still have to deal with the problems inherent to the other three. It is separate as far as taxes and everything of that sort, but it's not totally divorced of other inherent issues.
Thank you. Microphone 1.
Well, Malay, I have a question. Can you tell me if you can discern how they're going to judge outcomes and how transparent will that information be to the public?
Would this question be for Team A or Team B?
Both, but I think especially Team A.
Okay. To make sure we can keep fielding questions, let's try to keep this response a little bit more brief. We can have Team A and Team B both respond, okay? So would you mind restating your question one more time?
Sure. What we're talking about here is, are we going to have quality care come out of this system? So I'm asking if you have any information or even if there's any data about outcomes to date. And if so, who can look at that data and how transparent is it?
Right. So I think we can frame that question around what is this going to look like on patient care, quality of care, and how transparent is that process going to be?
Yeah, I think the goal of the company is to be as transparent as possible. I mean, the CEO, Dr. Gawande, he is the author of Being Mortal and, the checklist, which was actually designed internationally to improve healthcare outcomes in surgical operating rooms. So I really think that he's going to do his best to be as transparent as possible. They have, unfortunately, no information about how they're going to measure it specifically. The first thing they're going to tackle is the technology of it. So I think as this progresses, I think we'll have a better idea.
Also, I'd say that a lot of the language that's being used is very analytical based and less healthcare based. Quality is historically very hard to judge and means something different to everyone. So again, we could speculate as everyone else is doing today, but we don't really know what that's going to mean to these companies in their not-for-profit venture.
Microphone 4.
Thank you. Michael Baxter from Berks County. I'm unfortunately not very familiar with this proposal, but hopefully you are. I present this question to both teams. I think everybody in this room, and especially the medical students, are still taught that the most important thing in healthcare is the establishment of a high-quality, meaningful, trusting doctor-patient relationship. I wonder what you think that this venture, I suspect that there will be telemedicine, I suspect that there will be non-physician providers used extensively in this model, and I wonder what you think will be the impact on the doctor-physician relationship.
Is that question for both teams?
Yes.
Okay.
Yes.
So one of the things that Amazon had said clearly in regard to this venture is that they want to make a direct-to-consumer healthcare system. Imagine a system where you can go online and you can shop for your favorite doctor, and based on reviews and whatnot, you can actually pick them. Ultimately, this can lead to negative things, but Amazon really wants to make it a direct-to-consumer thing. Cut out the middleman, reduce costs. There is no reason healthcare should be as high as it is when our health outcomes are just so poor as it stands.
I want to focus on the telemedicine side. If they would use something like Doctor on Demand, if you actually look on their website, you can go and see a physician through your computer. And they said they could do everything from a history to a physical exam. I'm really not that sure how you can do a physical exam over a computer screen. I think that this overall would diminish the doctor-patient relationship, because if you really want to lower healthcare costs, that would be one way to do that. However, you're losing that continuity with a family physician that you normally would have. And furthermore, you're going to lose that interaction being in the same room with your physician. So I think that it would definitely be detrimental if they took that route, which again would just be speculation.
Now, unfortunately, this time we do need to move on to the closing statements, but I do invite any physicians that wanted to ask a question for any round. If you run out of time or don't get a chance, please feel free to seek us out, those participating in the debates afterward. We'd love to hear your questions and further engage in these conversations, but we do need to keep on schedule. So, unfortunately, we do need to move on to the closing statements for each team. I will invite Team B to speak for 60 seconds on their closing statement.
So the overall message that we're trying to get across is that this very well may be a noble goal. And it definitely brings into question many of the issues that we have in the current healthcare system. But we don't believe that this is going to actually fix really anything. At most, it's going to be very inefficient. Because there isn't that much solid evidence on what they want to do, it's hard to argue exactly what will be effective and what will not. But if you want to lower healthcare costs, it's kind of hard to argue that you're going to also raise the quality of that, especially through some of the means that they suggested. So I think that overall this would be detrimental to the doctor-patient relationship, especially if they use the telemedicine. I don't think that it's going to be sustainable over a large amount of time, and I don't think that we should be using a quote-unquote social experiment on the employees of these three companies just to try to fix a problem without really thinking it through.
Thank you, Team B. Team A, you have 60 seconds.
We talked at large about the state of the healthcare system as it is now, with more than 10,000 per man, woman, and child per capita in the U.S. now. Admirably, this triumvirate takes aim with a reputable CEO who is stepping down from his stepping to a lower level of management in his current appointments. This triumvirate is going to disrupt the status quo of medicine and healthcare. But much like telemedicine and the advent of non-physician providers, it's going to have its place. It's not going to change everything overnight. It's going to work with the existing systems. No corporation is without problems, scandals, and the Amazon mistreatment of its employees does not have any voting on this triumvirate.
Thank you, Team A. We'll get a round of applause, please, for both teams for doing a great job representing this issue.